I am Dr. Adam, and with the Bright Minds at Beatrice, we'd like to take you on a healthcare and wellness adventure with these two delightful helpers, Fizz and Emmy, and a team of specialists, Dr. Saul, the knowledgeable Dr. Aisha, and the professor with unparalleled medical expertise, Dr. John. We'll help the ill family who always think they're ill deal with the many health problems that come their way and learn a thing or two ourselves as we go along. Now, shall we get down to important matters? Because your health matters.
Hey, what you doing there, son?
I don't know, Dad, but this thing is so cool.
Never a dull day when the ill family visits, is it, Dr. Adam?
You said it, Dr. Saul. Bill, that thing in your hand represents cholesterol, which is found in every single cell in your body. Excessive cholesterol causes plaque buildup in the vessels.
Get out of town, no way.
That's hard to believe.
Dr. Adam's right, guys. Cholesterol plays a very important role in all our bodies. It is required for digesting food, producing hormones, making vitamin D. It even maintains the structure of our cell walls.
Yeah, but look at the shape of that thing. Can you help me understand this, Dr. Saul?
Emmy, could you turn off the lights for Dr. Saul, please?
Right, so cholesterol is one of the substances manufactured inside all our bodies. It originates from the liver, which is responsible for making all the cholesterol needed for us to function properly.
Foods like meat, poultry, and full-fat dairy products contain cholesterol. But these foods are also high in saturated fat, which encourages the liver to make more cholesterol than is needed.
Oils like palm oil or coconut oil can also trigger the liver to manufacture cholesterol.
Baked items as well.
Okay, so what do we do with this info?
Well, too much of cholesterol can lead to high blood cholesterol,
which is basically a condition that causes the levels of certain bad fats to be too high in the blood.
When cholesterol levels rise above normal, the doctor may give a diagnosis of high blood cholesterol, medically termed as hypercholesterolemia, hyperlipidemia, or lipid disorder.
Dad?
Yep, I may have all of those.
You see, cholesterol circulates in the blood, and as the levels of cholesterol in the blood rise, so does the chance of getting heart disease or having a stroke.
Dad, did you hear what he said?
Hey, it's all fine, Bill. Just look at me. 75 and still going strong.
It is recommended that everyone should visit their family doctor for a screening test, Will.
Healthy men should ideally get tested by the age of 35 years, and women by the age of 45 years.
Oh.
It is more common in adults. Most children with high cholesterol will either have one or more parent who has high cholesterol. Raised cholesterol is estimated to cause 2.6 million deaths yearly. This accounts for 4.5% of the total population of the world. 4.5%!
About 37% of men and 40% of women have high cholesterol levels globally. And here's something very interesting indeed. Over 50% of adults living in high-income countries have high cholesterol, which is more than double that of those living in low-income countries. Lowering total cholesterol level by 10% in the middle-age bracket, about 40 years, has been shown to reduce the risk of heart disease by 50% within 5 years.
Well, seems like I missed that boat, Doc.
It's never too late to take care of oneself, Will. Certain factors can increase the risk of developing high cholesterol.
And a poor diet is one of them.
Obesity is another. You must always make good food choices. Having a waist size above 40 inches or 35 for women is a sign. A big one.
Well, that's just too bad. It is Cuban and you will give it back. Why, you little...
Smoking.
That's a big one. Stop smoking, guys.
Are there any other factors, Doc?
High blood pressure or diabetes.
Is that why you called us in?
There are consequences of having high cholesterol, Bill and Will. If there's too much cholesterol in your blood, it may very well accumulate in the inner walls of the arteries. We call it atherosclerosis.
Over time, these fatty deposits called plaques may form. leading to narrowing of the artery, and these plaques are at risk of bursting.
And guess what follows?
What?
Blood clots in the arteries. Narrowing of arteries can lead to reduction of blood flow through the arteries, causing chest pain, heart attack, or stroke.
However, this can be easily avoided by monitoring your day-to-day life.
Like Emmy has so kindly shown you,
Exercise every once in a while.
at least 3 times a week for 30 to 45 minutes.
It does wonders.
Ha! I'm whooping you with this, son. Try to catch me, old man.
Well, at least they're exercising. Thanks, Saul.
Always a pleasure, my man.
Cholesterol is a soft, wax-like substance that is manufactured by the body, but can also be absorbed from foods like meat, poultry, and full-fat dairy. Cholesterol circulates in the blood, and as the levels of cholesterol in the blood rise, so does the chance of getting heart disease or having a stroke. Raised cholesterol is estimated to cause 2.6 million deaths yearly. Certain factors can increase the risk of developing high cholesterol, such as a poor diet, being physically inactive, smoking, being obese, and having diabetes. If you have high cholesterol, your doctor will prescribe medication which will help lower your blood cholesterol level, alongside informing you how to modify your lifestyle to lead a healthier life. Matters of health matter. Keep that in mind. You can visit the below website to gain more information on health and wellness and access the Health Matters with Dr. Adams' series of videos. If you feel you need further healthcare and wellness information, you may consult with your family doctor.